I'd like to welcome Dr. Lisa Dana, a pediatrician at Golden Gate Pediatrics, serving children in San Francisco and Marin County in the San Francisco Bay Area. Thank you for being with us, doctor.
Thank you, Gasia.
Let's start, Dr. Dana, by focusing on how the coronavirus is affecting children specifically.
With children, we're seeing a real range of symptoms. And we're not testing that many. We're not sure that they have it, but from the symptoms that are common with them, we think it most likely is. So it's aches, low-grade fever, headache has been one that I've seen a lot, kind of a persistent headache. The fever is not high. It's in the 100, maybe 101 range, but it's not a really high fever, generally speaking. They will also get some stomach GI side effects, where a little stomach ache, maybe some diarrhea. The other, of course, a mild cough is associated with it as well.
If a parent says, oh, my child is a little bit sluggish, has, the lowest of all fevers, but isn't presenting, let's say, a cough or any one of those other sort of hallmark symptoms of coronavirus, what should the parent do?
If you're concerned that your child might have coronavirus, I would go ahead and call your doctor. We are doing telehealth visits, and we started those live about 2 weeks ago, where we'll screen the patient, see what's going on with them, and see if it's okay for them to be treated safely at home.
You were talking about doing a televisit. What sort of home treatment might there be if a parent is told by their doctor that the child might have coronavirus?
For mild symptoms, I always say treat the whole child. If they're looking great, fluids, rest, good food, nutrition, that's the most important. Washing hands regularly. It's, of course, always hard to separate care when we're caring for our own children, especially younger children. So making sure that we are really trying to keep them safe and isolated from other people.
It's stunning to me how the situation with coronavirus is changing. I can think back even just 2 or 3 weeks ago, and there was the thought out there that really it's the elderly or people with compromised immune or breathing systems who are most at risk. In the past days, we've seen reports of children dying related to the coronavirus.
There have been reports of fatalities in children. It's, children are getting sick, especially the children at most risk are children with asthma, diabetes, autoimmune diseases, arthritis, rheumatoid arthritis, things, juvenile issues that can put them at a higher risk. And then we are seeing it also in older teens and young adults who may not have those medical risk factors, but maybe have, compromised their lung function with vaping or other things that might be putting them at increased risk too.
Let's talk about those teens and young adults. It is very hard to keep a 14-year-old from wanting to see his or her friends. And I know that a lot of parents are taking these stay-at-home orders very, very seriously. But I hear from my friends who have children older than mine, and we'll get to the little ones in a minute. They say, my friends want to get together to pass the time. They want to go on a walk together. They want to, get together. What do you say about those, those play dates or those friend over situations that most, adolescents almost live for these days?
I know. And it's so hard because even if they say they're going to stay 6 feet apart or more than 6 feet apart, it's almost impossible for them to. They're like magnets. They want to come right together. So I just say, keep them at home, be with them if they want to go outside. They just need that. Unfortunately, our, really responsible young adults and teens really just need to stay home.
So really, even though it might sound weird telling your 17-year-old son, you can't go to Billy's house, you're saying he can't go to Billy's house.
He cannot go to Billy's house. He cannot go to Billy's house. He might get sick. He might also get his mom or dad sick.
Right, because
we are seeing people in their 50s get very ill from this disease.
And another huge concern is that many people who might have the coronavirus are asymptomatic. So we all know to stay away from someone who's, coughing at the grocery store, right? But you really don't know who might have it.
Right. We think about 1 in 4 people do not have any symptoms. And those are the ones that are the super shedders. They're shedding they're spreading the virus. I think that's part of the reason why they've implemented the new mask recommendation. I'm sure you've read about that today. But for essential trips, and really essential trips are only to the grocery store and to the pharmacy. Those are your essential trips. And it's not to take your bike to a place to go mountain biking. That's not an essential trip. But to wear a mask when you do have to go into the grocery store or the pharmacy, and a cloth mask is what's recommended right now, so we can save the surgical masks for healthcare providers.
Right. I mean, so that recommendation became sort of, statewide yesterday. So I had to go to the grocery store. I'm only going once a week, and I had my mask with me, and I thought I feel kind of foolish putting it on, but I sort of forced myself to wear it. And when I got into the store, I saw that most other people were wearing one as well, so I felt a little better.
Right. I've been telling my own family, if you think you're overreacting, you're probably doing a good job.
Oh, I'm going to steal that one for my family and for our viewers here as well. Let's talk a little bit about the younger set of children. My little boys are 9 and 10 years old, and, they know better than to ask to go to Billy's house, but their truest happiness is riding their bike, getting on the skateboard, doing tricks on the scooter. But you actually advise against that. Tell me why.
Well, accidents happen. And so we really are trying to keep those kids out of the ER if we can. I know of 2 cases this last week of a bad accident, a bike accident in a kind of exactly age range of your children, a little bit older maybe, and an older young adult who was in a skateboard accident with, broken bones. So those need to be seen and how to see it. And it's just, the care becomes more, it'll happen. You will always get great care here, but the care becomes more complicated.
Right. I mean, in sort of lecturing my boys as to why they can't do those tricks, I said, the doctors and nurses are busy right now, and they don't need to be busy with you with a sprained arm, because they're saving lives. They're not, bandaging a little boy's elbow.
Right. Exactly.
Good.
I always used to tell my kids, we do not want to end up in the ER after today. Let's just not do that. Let's let that be a goal.
Right. I agree. Let's go ahead and let that be a goal. Let's talk about something that most people are doing. You mentioned going to the grocery store, and now there is that widespread recommendation of wearing not a medical mask if you're not a medical provider, but maybe a bandana.
Right.
My mom used to wear, or she still does wear, masks when she vacuums because she has asthma. Because I have a health expert with me, can you tell me, how do you go to the grocery store when you have to? What's your procedure?
Well, I do have, so I have a mask that I've been reusing actually, because there's a shortage of them. And I haven't gone that often actually. So, but if I have had to go, it's the mask, glasses, and then I wash my hands really well before and after. Everything stays outside. I wash it and bring it in.
Okay, that's what we should all be doing.
But I have the surgical mask, but
right, right, because
a bandana would be great.
Right. It's funny. We it's not funny, but we happen to have a couple of N95 masks that we used a few years ago during the North Bay wildfires, and I'm just using that. I mean, I'm not certainly going to go buy one because you need it more than I do. Is reusing an N95 from a couple years ago better or worse than a bandana, or at this point, is it use what you have?
A cloth works. What we're trying to do is decrease our risk of transmitting the virus if we don't have symptoms to somebody else, and to just slow the spread. Okay. So I think a cloth bandana is just as fine. I actually, that's the mask that I've been using because we actually had a shortage of them as well. Wow. So I had to pull down our fire mask supply from, I think it was last summer.
Yeah. Interesting. So tell me, we talked about what children shouldn't be doing, right? Tricks on the scooter and the bike. It's concerning to me because the children are home from school and they can't do some of the bike and scooter fun things that they usually like to do. I'm concerned about keeping their spirits up, and I'm very lucky that so far they are happy. We've been a little more lenient at home, a little more screen time than usual. Is kind of the whole child health as important as purely the medical health of a child?
Absolutely, but it's also important for family health. It's important for your health as a mother. You have to, I saw this great line last night at AP, take a breath. In medicine, we always say, take your own pulse first. You have to feel whole to kind of spread that calmness with your kids. And it's okay to explain what's going on with the kids. They know things are really different.
Right.
So right. I think it's important that we give ourselves a break too, as parents. I'm in these families' homes and I see them, and they're 2 working young parents with toddlers running around them, and they're trying to work so that they can keep paying their bills, and they don't have any caregivers, and everything's changed. And I just think it's okay. It's not the time to get rid of the pacifier if you don't need to get rid of the pacifier.
Right, right. YouTube can be your friend.
Right. I had one family said, I think our child's becoming, is going to get a PhD in Disney. I'm like, that's okay.
That's great. She's healthy, you're healthy, it's okay.
So I do think we have to make sure that, you know, and it's hard because I think in social media, we see these families who look like they're crushing this. They've got
Right.
theme nights and they're everything, you know, they've got the family TikToks and I'm like, wow, that is not happening here.
Right. Right. And it's interesting that you mentioned social media because it can be a great tool for communication and commiseration, but it can make me as a parent feel very bad about, oh wow, I didn't do that for my child. Or you see these school schedules, right? 8 o'clock wake up, 8:30 breakfast, 9 o'clock math. And I think, wait a minute, if we get a couple worksheets done, I think we're good today.
You're doing great. I think you're doing great. I really do. I think we need to give ourselves breaks as parents, and I love everybody's putting those great things on social media because they're great to watch. But if you're not doing the same thing, guilt be gone. Do not feel guilty about that.
I like it. And from an official too, since you've been working so hard during the coronavirus crisis, is there anything that you've seen families or members of the public do that either makes you think, that's a great idea, more people should be doing that, or you see something and think, oh, no, don't do that? What would you like to share from your personal experience and observation?
I would say I think families are still trying to get together because they're so overwhelmed. I think there are, of course, there are essential workers who do need childcare, but I do also think that if you're not an essential worker and you do have to have that toddler at home, try not to bring in the outside caregivers because you just don't know what's going to happen from that. I think that's one thing I would say to be careful of. Things that I think are great. I do think those family theme nights are great. I saw a great one, an airplane one that Tina Fey did with her family. I thought that was hysterical. Fresher walks with your family are great. I think the benefit of this is that we get to actually enjoy meal times with our family. So if you can do that middle of the day lunch meal time, I mean, that's awesome.
Right.
And getting the kids involved in cooking is really fun too.
I imagine you would also stress the importance of healthy eating. I know a lot of parents joke about, guess it's goldfish crackers and apple juice for lunch today, but really the basics of good health do start with nutrition.
They do. And I've actually had a few visits this week with, the kids who are the picky eaters. And, those things are still happening. People are still having the same health issues they had before that are happening now. And I'll tell these kids, and I say, you know why you're home? And they're like, yes, because some kids call it the illness. I'm like, yes, the illness. I said, and the only thing that we know we can do right now to protect ourselves is to eat well, hydrate well, get to sleep on time. So I'm, constantly sharing that with my families.
Before my little boys were told that school was going to close for the rest of the school year, they had a school-wide assembly on the importance of hand washing. And any parent with 2 children knows you usually have one who plays by all the rules, typically the firstborn, right? And my older one, he was just an ace hand washer from day one. My little one sometimes would fudge it, but the other day he was at the sink, and they've been out of school now, I think, for 3 weeks. Time is melting together. But I saw him wash his hands like this, and then he did this, and he did his wrists, and I thought, you go. I was so proud of him.
Yeah, that's great. And it's so important to remember to do that. And that brings up a good point. We're doing, the Bay Area has done a really great job of social distancing. I credit Mayor Breed and Governor Newsom for that. I feel like specifically our Northern California area has done great, but we can't loosen up. We have to keep hand washing. We have to keep up with the social distancing. Just because the news seems to be a little tiny bit better in our area, we need to continue with what we're doing.
We've heard so much about flatten the curve. We've heard Mayor Breed in San Francisco and Gavin Newsom in California say we need to be prepared for when the surge hits. Do you have any estimation based on your experience and observation how far into this we are, or are you also waiting for the worst of it to come?
I think we're all waiting. I think we're all waiting and holding a collective breath. We're seeing what's happening in New York, and it's devastating. And we want to do the best we can to help them from afar, but also make sure that we're doing the best here to keep it not as severe as there. So I think if we keep doing what we're doing, and we started the social distancing and the shelter at home just a little bit earlier, and I think actually every single day counts. Every day counts. It's exponential. So if we start a day earlier, that might affect things.
Are you still seeing patients in your office, or how does it work for you? For those patients who can't do telemedicine, do they still come to the doctor's office? And the reason I ask is if there's a parent watching this who says, I need to take little, Jimmy to the doctor because he did break his wrist. How does a parent take a child to either the doctor's office or the emergency room safely?
It is a safe place. The emergency room is a safe place. If you have to go to the emergency room for a broken bone, go to the emergency room. Don't not go. What we do is we screen all of our patients with telehealth, and we see if we can treat them at home. If they need to come in, we see them, and we take precautions, and we only see the sick kids and they're basically well sick kids. They're kids who might have a laceration or a cut or something like that. The rest we are primarily seen by telehealth. For the new babies though, and new babies are being born, and I've got to give a shout out to the new moms and dads out there who are having new babies right now, because they are often having their babies by themselves or with just their partner. They're going home. They are in isolation with this brand new baby for the first time. But those new babies still need their immunizations. And so do the young babies. So we don't want to come out of this and have another whooping cough outbreak or another measles outbreak. So we are bringing in the well babies. We're only allowing one provider, one caregiver per patient to come into the office. They're screened outside of our office with, we take their temperature before they come in. All of the staff in our office are wearing masks now. So we are really trying to limit, by space and time, how many people come in, but we're getting those babies in because they need to come in.
Yeah, it's so interesting how many people are having changing opinions on vaccinations, on just, general upkeep of basic health, because people are now realizing you have to have this strong. So when the unforeseen does come at you, at least your core is strong. Dr. Dana, I know you're very, very busy. Is there anything else you'd like to share with our viewers about the coronavirus as you see it?
I would just say, really take care of yourselves as parents, as mothers and fathers. I know your parents give the time and take your own pulse first. Take care of yourself. Keep your social distancing as much as you can, and keep washing those hands.
Okay, you got it. Wash them like this, wash them like this, and like this. Dr. Lisa Dana, pediatrician with Golden Gate Pediatrics, serving San Francisco and Marin County in the Bay Area. Thank you so much for joining me. Be well, and thank you for your work in serving your community.